An electrocardiogram, often abbreviated as EKG or ECG, is a test that measures the electrical activity of the heart. This is an important diagnostic tool that can be used to detect a number of heart conditions, such as arrhythmias, heart attacks, and other cardiac abnormalities. We created this video to cover the medical definition of an electrocardiogram and provide a brief overview of this topic. So, if you're ready, let's get into it. As previously mentioned, an EKG is a test that measures the electrical activity of the heart. It's a non-invasive test, which means that it does not involve any needles or injections. The electrical activity of the heart is produced by the coordinated contraction of the heart's 4 chambers. The 2 upper chambers, known as the atria, contract first. This is followed by the 2 lower chambers, known as the ventricles. The timing and sequence of these contractions are important in ensuring that the heart pumps blood effectively. So how exactly is an EKG measured? The electrical activity produced by the heart's contractions can be detected by electrodes that are placed on the patient's skin. These electrodes are connected to an EKG machine, which records the electrical activity and produces a graph that can be interpreted by medical professionals. Now let's talk about the electrophysiology of the heart. The electrophysiology of the heart refers to how signals and electrical impulses are conducted within the heart. There are a number of different parts of the heart that are involved in this process, including the Sinoatrial Node, atrioventricular node, and the Purkinje fibers. The SA node, also known as the pacemaker, is responsible for setting the heart's rhythm. The wave of depolarization that originates from the SA node is responsible for causing the atria to contract. This is known as a P wave on an EKG reading. The impulse is then received by the AV node, which causes a short delay. This delay is interpreted as a PR interval on an EKG tracing. Then the stimulus moves through the bundle of His, through the left and right bundle branches, and into the Purkinje fibers. This produces ventricular depolarization, and contraction occurs, which can be seen as the QRS complex. Then the heart enters into a short period of repolarization, which is a period that no electrical activity can be detected. This is known as the ST segment on an EKG tracing. Finally, the heart enters into a period of recovery where the SA node is recharged and another cycle can begin. There are 2 primary components of an electrocardiogram: electrodes and leads. Electrodes are small metal discs that are placed on the patient's skin. They are responsible for detecting the electrical activity of the heart and transmitting it to the EKG machine. Leads represent the electrical activity of the heart from a specific angle. There are 6 different leads in an EKG reading, which are referred to by the letters 1, 2, 3, AVR, AVL, and AVF. But we'll talk more about those in another video. But for now, let's talk a bit more about the EKG electrodes. As previously mentioned, there are 6 standard electrodes that must be attached to a patient's chest during an EKG in order to obtain a reading. This includes the following: V1, which is placed on the 4th intercostal space on the right side of the sternum. V2, which is at the 4th intercostal space on the left side of the sternum. Now let's skip to V4, which is at the 5th intercostal space on the left mid-clavicular line. And going back to V3, it is located between V2 and V4 on the left side. Now let's do the same thing and skip to V6, which is at the 5th intercostal space on the mid-axillary line. And going back to V5, it is located between V4 and V6 on the left side. Each electrode has an adhesive backing that is placed on the patient's skin and then connected to the EKG machine. This allows the machine to detect the electrical activity of the heart and produce a graph that can be interpreted by doctors and medical professionals. If you want to support the channel, be sure to like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day, and as always, breathe easy, my friend.